Following the written and written rule, you need written permission from the parent and written instructions from the child's healthcare provider to give any medication. There are some exceptions to the written and written rule when applying over-the-counter topical ointment, sunscreen, and topically applied insect repellent. In certain circumstances, when you do not have written permission from the parent or written instructions from the healthcare provider for a prescription medication, and in certain circumstances, when you do not have written permission from the parent or written instructions from the child's healthcare provider for an over-the-counter medication. Let's look at each of these exceptions more closely. Since regulations do not consider over-the-counter topical ointment, sunscreen, and topically applied insect repellent, including lotions, creams, gels, and sprays to be medication, you'll only need written permission from the parent to apply it. Have the parent fill out the OCFS non-medication consent form for over-the-counter topical products. You may also use your own form as long as it's approved and stated in your approved healthcare plan. If the parent's instructions don't match the instructions on the medication package, you must get written instructions from the healthcare provider on the written medication consent form or the approved equivalent. For example, many packages say to consult a doctor if the child is under 2 years of age. In these cases, you must always have written instructions from the healthcare provider to give the medication to a child under the age of 2. If you're not able to get written or fax permission from the parent, you can apply the ointment with verbal permission for 1 day only. You'll need written permission from the parent if you want to continue to give the medication. Sometimes a parent may arrive at your program without written instructions for prescription medication. This might happen because the parent didn't have the form with them at the time the prescription was written. If the parent asks you to give the medication but does not have written instructions and the child is 18 months or older, you can administer over-the-counter or prescription medication with verbal instructions from the parent for 1 day only. For children under 18 months of age, you can administer over-the-counter or prescription medication for 1 day only with verbal permission from the parent and verbal instructions directly from the healthcare provider or licensed authorized prescriber. Remember, you can only accept verbal permission and instructions to give over-the-counter or prescription medication in your program if this is written in your approved healthcare plan. If someone other than the parent drops off the medication at your program, you can get verbal permission from the parent to give it. But be sure the parent understands that if the child is younger than 18 months of age and the healthcare provider does not call you or fax the written instructions, you will not be able to give the medication. Remember, verbal permission and instructions are good for 1 day only, so you will need everything in writing to continue to give the medication. OCFS has an approved form where you will write down the permission and instructions you receive over the phone. You can only accept verbal instructions directly from the child's healthcare provider or licensed authorized prescriber. So be sure to ask the person you speak with their name and title. Once you have verbal permission and instructions, make sure you write down any doses you gave on the verbal consent form. Be sure parents know all doses given during the day. An easy way to do this is to have them sign this form at pickup time. And remember to return the medication to the parent at the end of the day if you don't get written permission and instructions. It's always best to follow the written and written rule by getting written permission from the parent and written instructions from the child's healthcare provider when giving any medication. But in the case of these exceptions, you need to check your program's approved healthcare plan for how you should handle these situations.